Experts say staying active as you age is crucial. That is why Cedars-Sinai has launched its Healthspan Clinic, which focuses on quality of life, longevity, and independence.
Dr. Sara Espinoza is the medical director. She's joining us to discuss how we should all be thinking about long-term health. Thank you so much for being with us this morning.
Thanks for having me.
You know, I think so many of us sit back and I go, well, my grandmother lived to be 93.
Yeah,
so
I'll be fine.
My genetics are good there,
Right.
so I'm fine. But what do we really need to be thinking about?
Yeah, so genetics does play a role in how
Sure.
we age, but there are other factors that are probably more important and are things that we can change. So like our lifestyle habits, how active we remain as we age, as well as like our diet and sleep, mental health, social engagement. So there's a lot.
There's a lot to think about, and I'm guessing that's why you guys have launched this clinic, because we must not be doing amazing with handling all of those things.
I can already tell we're not doing it.
Yeah.
Diet, sleep, I'm like,
Failing.
Yeah, so I think, there's a lot in the media about healthy aging right now with our growing aging population.
Yeah.
So I think people are naturally curious about what they can do to improve their health with aging. And so it can be, I think, a little confusing for people.
Sure.
So that's kind of the reason we wanted to launch this clinic, is to really provide some evidence-based recommendations to the patient, individualized to what they can do to improve their health with aging.
Sure.
Great.
Well, I think about things. My mother doesn't probably want me talking about this, but it's one of those things. She's going to be 70. But I look at my mom. I feel like she never thought she was actually going to get older. Like these boomers all thought that they were going to live forever.
Right. Forever young.
Then like things like Botox and stuff came out, so they could even look younger and feel younger. But there are things that she's even talking to me about now that she's never thought about before, like her mental health and taking care of that. Like, she's been so busy in life, and now she's kind of at this age where it's slowing down, but that's a huge part of it.
Yes, absolutely. So, as we age, there is an increased risk for depression and anxiety and mental health issues. So it's important to, keep your eye on those things and seek help if needed. And in our clinic, we will do some screening for those and offer referrals if needed, but we can also treat for that.
Later.
There you go. Listen, she throws her mom under the bus on the show, Dr. Espinoza, so get ready. We're going to send her over there.
No, I love it.
I want to know, this is available for everyone, but really, who's it ideal for? Is it someone in their 20s or 30s who says, when I'm 70, 80, I still want to be active and feeling good? Is it someone who's already aged and maybe doesn't like the results so far? Give us examples of who you can help most.
Yeah, so we're seeing pretty much anyone 18 and over. I think it kind of depends. I mean, I would say probably ideally middle age and above, because what we really want to do is help people before they have the impacts of a lot of chronic diseases, if we can. But I do want to say that it's never too late to make positive changes to improve your health, even if you're already, chronic diseases.
Clinical trials all the time, and they would go and my grandmother would ride like an exercise bike to see, and then they test her lung capacity and all those types of things. You're offering those same types of things, and I know for my grandparent it was super helpful to kind of get a gauge of where they were at and also be at the forefront of some of these advancements.
Yes, I'm glad you mentioned that, because we have launched a whole program of aging research at Cedars-Sinai, which I'm a part of, and this clinic is sort of like a dovetail with that, with the research side of the clinic. And so it's an option, but if patients are interested in learning about clinical trials that we're doing at Cedars-Sinai, we can let them know about that, and so that is something that they could participate in if they would like.
My grandparents loved it because they felt like they were still being competitive.
Listen, I love a Jamie fun fact. Now I'm picturing your grandparents in all the health trials, but you guys are doing some really important work. Thank you so much for being there.
Thank you.
Jamie and I need to sign up, because these brains are falling apart, Dr. Espinoza.
I've given up. But to everybody else out there, good luck.
Thank you for
doing great.
We appreciate it. Thank you.